This video provides instructions for using the Care Essentials Cocoon CLM0104 upper body, arms out disposable blanket and is intended for clinicians only. The Care Essentials CLM0104 upper body, arms out disposable blanket assists healthcare professionals in managing patient temperature in the perioperative and other clinical environments. The blanket can be used with adult patients. The design of this blanket makes it suitable for a variety of different surgical specialties. Prior to use of the Cocoon forced air warming system, consult detailed product indications, limitations, safety information, and instructions in the provided User Operator's Manual and Preventative Maintenance Manual. The Care Essentials Cocoon CLM0104 upper body, arms out disposable blanket is often used in operating rooms to help prevent and treat unintended perioperative hypothermia. When arriving in the operating theatres, the Cocoon upper body, arms out blanket is positioned on top of the patient. This video demonstrates how to set up the blanket for a patient in supine position. First, remove the blanket from the packaging and unfold on the patient. The port entries at the top of the blanket indicate which end is to be placed at the top of the table. The blanket should be placed with yellow side facing up towards the clinician and with the white side making direct contact with the patient's skin. The blanket has two arm board ties at each side to provide a secure blanket positioning. There is an adhesive strip at the bottom of the blanket. This can be used to secure the blanket to the patient, reducing the likelihood of any blanket movement during the procedure. There are two resealable port entries at the top of the blanket for convenient positioning of the Cocoon CWS 5000 warming unit. Once the blanket has been properly placed on the patient, it is time to begin warming therapy. Select the preferred port entry from one of the two ports found at the top of the blanket. Tear the Break tab to open tab and unfold the material to open the port entry. Insert the hose of the CWS 5000 warming unit into the port entry and ensure the port entry ties are parallel to the tie here visual aid on the CWS 5000 hose. Secure the hose by tying the ties in a bow over the top of the port entry. Support the hose by attaching the blue clip to the table to ensure a secure attachment. Connect the warming unit to a properly grounded power source. Select the desired temperature and fan speed. If the patient is intubated and ventilated, the attached clear plastic head drape may be used to reduce heat loss around the patient's head without hindering visibility for the clinical team. The microscopic perforation pattern on the white side of the blanket provides even distribution of warm air across the patient, whilst eliminating disruption to the surgical field using a latex-free blanket fabrication. The design of the Cocoon CLM0104 upper body, arms out disposable blanket means it's versatile and can be used in a range of surgical procedures, whether the patient is in supine or lateral positions. If you have questions, refer to the warming unit's operator's manual. To end warming therapy, either turn the unit off or switch to standby mode. Disconnect the hose and discard the blanket according to hospital policy. The following are important patient monitoring recommendations for the Care Essentials Cocoon forced air warming system. Continuously monitor a patient's core temperature. In the absence of continuous monitoring, monitor the temperature of patients who aren't capable of reacting, communicating, and/or who cannot sense temperature, a minimum of every 15 minutes or according to institutional protocol. Monitor cutaneous responses of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to institutional protocol. Adjust air temperature or discontinue therapy when the therapeutic goal is reached. If elevated temperatures are recorded, or if there is an adverse cutaneous response in the warmed area. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or in order of a licensed healthcare professional.